I'm Janet Rustow, Senior Clinical Social Worker at the Faulkner Breast Center. Here at the Breast Center, we're concerned not only for your breast health, your medical health, but also for your emotional health as you navigate your way through breast cancer treatment. One of the things that makes the center unique is having a full-time clinical social worker on site as part of the team. In this talk, what I want to do is talk a little bit about some of the typical emotional responses to breast cancer, talk some about what's helpful in dealing with those responses, and because so many of our patients have children and are typically very concerned about how best to help their children, I want to take a little bit of time to talk also about some general guidelines on how best to tell your children about your breast cancer. Breast cancer is actually a very odd disease from an emotional standpoint. Most illnesses give some warning that they're about to happen. We have some pain or discomfort, some fatigue, maybe some bleeding. We have a chance to think, I hope that's not that, or maybe I better call the doctor. We have some time to sort of try on the idea that something might be wrong. With breast cancer, there's typically no pain, no discomfort, no family history. Women are feeling fine, living their lives. They come for a mammogram, and they have breast cancer. They're taking a shower, they feel a lump, they have breast cancer. They may get told by their doctor that the breast cancer's actually been there for a long time. How can I feel fine and have breast cancer? Feeling fine is no longer a good indicator that everything's probably okay. So then, could something else be wrong too? Could the cancer have spread? Feeling fine is no longer assuring. Indeed, the diagnosis phase is typically the most anxious time. You don't yet know how aggressive your breast cancer is, where your breast cancer falls on the wide spectrum of types of breast cancer. You don't yet know what treatment you'll need or how you'll respond to the treatment. You need to make room in your schedule. You need to rearrange things. You're highly anxious. You may have needed to stop your hormone replacement therapy. And at this same time, you also need to be able to learn about all sorts of complicated medical information, to learn about what your treatment options are. For most of us, trying to learn complicated new information while we're highly anxious is a daunting task. I talk with women at this phase about how to manage anxiety, how to make choices between treatment options that will work well for them, what I think of as no regrets decisions, decisions you'll be comfortable with over time. Emotional responses will also depend upon a woman's individual situation. Women bring their strengths, their weaknesses, their challenges to the breast cancer equation. Women with histories of depression or anxiety, women with issues with substance abuse or drug dependence will have a more complicated time dealing with breast cancer. Women who are living with domestic violence, somewhat counterintuitively, domestic violence may actually become worse during this time, not better. Women with trauma histories, women with sexual abuse histories may find some of the interventions, some of the procedures very difficult to tolerate. If you have any specific concerns, please let us know so that we can work with you to make your treatment as tolerable as possible. Typically, the most helpful things during this phase are information, support, individual counseling, compassionate caregivers. This is generally not the time to start a new psychotherapy. It's also generally not the time to necessarily start a new support group. It's hard enough to keep one's own anxiety straight in one's mind without also having to support 7 other women who are dealing with their own acute anxiety. As a plan of treatment gets underway, typically anxiety will lessen. It becomes more of a physical process. Now there's surgery or chemotherapy. Now there are things I need to do. Now there are things that friends and family can do to help me. Like any crisis situation, the physical needs come first. The emotional needs often will subside a little at this point, perhaps to resurface later. I want to say a word about emotional responses after treatment, just because sometimes they can be a bit surprising. You'll hear people talk about post-treatment blues, or that the first year is the year of the physical, the second year is the year of the emotional. What this means is when the physical treatment is over, you typically have more time to think about what you've been through, to try to make sense of it. You may also have some anxieties about, could the cancer come back? Now I'm not doing anything to keep it away. Again, this is all normal. What's complicated is, as the treatment ends, your family and friends may assume that, well, you're fine now, right? The treatment's over. And they may pull away a bit. But actually, this may be the time that you need emotional support very much. This may be the time when counseling, psychotherapy, or a support group is more helpful. Because so many of our patients are concerned with how to best tell their children about their breast cancer, I want to spend a few minutes going over some general guidelines on how to talk with children about breast cancer. You need to translate these guidelines into the language of your own family, and individual consultations are always available if you want more information. But in a general way, it's always a good idea to tell children about your breast cancer. They probably already know. They pick up on increased anxiety in the home, or more phone calls, or that you're taking the phone down to the basement to have a phone call. They may actually be worried that something worse is wrong. Children and adults respond really more to how something is said than to what is said. Waiting for a time when you can talk about your cancer in a relatively calm way will help your children feel calmer about your breast cancer. It's important to use age-appropriate language and correct language. It's not a boo-boo, it's not tissue, it's not a lump. It's breast cancer. It's cells that are taking up space that really doesn't belong to them. Sometimes we're concerned that talking to younger children will be so upsetting to them. We just want to protect them from bad news. But young children are accustomed to getting new information from their parents all the time. And actually, they're less inclined to challenge you and say, well, I'm going to go double check everything online now. With older children, it may actually be a way of setting a good example that in our house, in our family, when there's something complicated going on, we talk about it. We help each other with it. We answer questions about it. It's not a bad lesson for older children. I hope you found this brief overview helpful. Everyone's individual and family situation is different. It's important to remember also that social work services are available to you throughout the process, diagnosis, during the treatment, as well as after the treatment, when it may also be more helpful to talk with someone. Good luck with this journey. Most of our patients tell us that the process, the treatment, ended up being not quite as bad as they had imagined, and I hope the same is true for you.